My big question is I'm going to see how is the body working? Is it functionally appropriately? Looking at why did you get cancer in the first place? Is it because your immune system's not working very well? Is it that you're just not making enough white blood cells? Or is it that your immune system isn't strong enough to be able to fight it off? Are you detoxing appropriately? And big nutshell, big down to earth thing that I'm looking at is the tumor microenvironment. Welcome back to The Root Cause. I'm Dr. Jake. I'm Dr. Jake Schmutz. I'm a naturopathic medical doctor and integrative physician where I have real conversations with real patients to show you how to heal your body down to the root causes without any harmful drugs or surgeries. I'm here today with my co-host and patient, Teresa Marie, to talk about the labs that I order for all my cancer patients.
Excellent, Dr. Jake. Thank you so much for having me on today to talk about this. As someone who I'm married to a man who has been struggling with cancer on and off, like just kind of on and off over the last 10 years, to be able to learn from you on the labs that he can start taking or start asking for so that we can really monitor and get to the root cause of why he's having it. And obviously the goal would be if you can get to the root cause, right? You can get yourself into remission. You can actually heal. I'm really interested in what you have to say today, and we'll be taking some notes. But also, I do want to let the audience know, and we'll talk a little bit more about that later, that we will have this list for them as well, where they can download it, and we'll talk more about that in detail. So first and foremost, Dr. Jake, can we first talk about like some standard practice labs that most oncologists do take, when it comes to their patients, and how you look at them differently?
Yeah, so let's start with talking about the standard labs that most oncologists do. So let's start with the very basic of the basic. So CMP 14, this also stands for a comprehensive metabolic panel. So this is you want to do this fasting because we want to get a fasting blood sugar. And this is going to tell us about your, like I said, blood sugar, liver, kidney function, electrolyte status. So it gives us a lot of different information on how your body is working. Conventional oncologists like to see, okay, is there any type of liver trauma? Is there any cancer that might be in the bones? Are the kidneys working okay so I could do some of the treatments we're doing? I like to see all that stuff too, but they're usually seeing it as like, can you take some of the toxic treatments that we're going to be doing and are you able to detox these appropriately? So that's a big thing that we're looking for there. Next thing is a CBC. So this looks at how is your bone marrow working? Is it producing a good amount of white blood cells or red blood cells? Do you have any type of anemias? So they're looking at it and from that lens. So I step myself back a little bit as I like to look at, okay, the white blood cell count matters a lot. It's not like, oh, I'm just not going to do chemotherapy if your white blood cell count's too low. Like if it's at 2 or lower, we need to work on building white blood cell count before we could do some chemotherapy. That's what conventional docs are looking at that for. Or your red blood cells. Oh, we don't want you to be too anemic because the chemo drugs that we're going to be prescribing are going to trash the bone marrow, and then that's going to make you even more anemic. So we got to build that up before we do that type of treatment. So that's what conventional oncologists are usually ordering this for. So they're seeing if they could do some of the treatments they want to do. I look at it in much more detail is I'm going to look at, okay, white blood cell count. I want that at a good range. I would love that to be at least at 7 to be able to fight cancer cells really well. A lot of my cancer patients have it at 3 or 2, especially if they've had chemotherapy. It's almost always at like 2 or 3. So seeing where the white blood cell level is very important to me. And then I also do this ratio is I look at a neutrophil leukocyte ratio. This tells me how well the immune system's working and also the inflammatory state. And it tells me a little bit of what's called the tumor microenvironment. That's a huge thing for how I approach cancer. What's causing the cancer to grow? There's so many different things, and a lot of labs I look at to look at that. And one of them is this neutrophil leukocyte ratio, which helps me know how is the immune system doing? How is the inflammatory state? So this very basic test, I'm getting quite a bit information from. Also, I'm able to see eosinophils. If I see elevated eosinophils, I'm like, okay, this person probably has some allergies. We need to look at their histamine response. Probably we need to look at some foods that they might be reacting to that's dysregulating their immune system, causing this chronic inflammatory state, adding to a poor tumor microenvironment. But also high eosinophils could possibly be like, oh, this person might have parasites that might be a piece of why the person has cancer in the first place too, is we need to go and take care of these parasites. So get a lot of information from a very easy, cheap test that's being done conventionally.
Okay,
Another thing,
before you move, I want to make sure and really get this to clarify for the audience, because I think this is really powerful. It seems like what you're suggesting then is that with the standard labs that are done by most conventional oncologists, so their big question that they're seeking to get an answer to when looking at these labs is this patient going to be able to handle the chemotherapy that they're going to be prescribed? That's the big question that they're trying to get an answer to from these labs. If you could summarize the big question you as an integrative doctor are trying to get an answer to from these labs, what would that big question be that all of these would be adding up to?
my big question is I'm going to see, how is the body working? Is it functionally appropriately? Looking at, why did you get cancer in the first place? Is it because your immune system's not working very well? Is it that you're just not making enough white blood cells? Or is it that your immune system isn't strong enough to be able to fight it off? Are you detoxing appropriately? And big nutshell, big down to earth thing that I'm looking at is the tumor microenvironment. That is the big thing I'm looking at. Is the tumor microenvironment is what makes it grow or not grow. So when cancer is growing, has all these things accumulated in that microenvironment. That's what's surrounding the tumor, helping it grow. There's all kinds of things that could do that, like inflammation or a pure immune state or other things that we're going to talk about in the future. So that's what I'm looking at with some of these basic tests, is the functionality of the body. Conventional doctors looking at, are you healthy enough to do my treatments? I'm looking at, how is your body doing? Is it able to fight off cancer? Do we need to support some pathways to help you fight off cancer appropriately?
Excellent. And it seems like that's how that integrative nature can work. So anybody who's listening to this, see how can this complement what they're doing already with a traditional oncologist, is we got one that's working on actively like fight, 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 get rid of it. And another doctor like yourself working on healing the environment that allowed the cancer to grow in the first place. So when the two get together, when you got a healthier environment that wouldn't allow cancer and you're fighting the cancer that already exists, you can see what a powerful combination that this can be. Thank you so much for clarifying that. Okay, so we've
Yeah.
discussed some of the basic labs that a conventional oncologist would look at. Please go further into what you would do and look at differently, and then other ones that you might add to the mix.
Yeah, some other conventional labs that your regular chemotherapy doc or oncologist would do are cancer antigens. So for like, there's various cancer antigens, but I'm just going to talk about some that are like related to breast cancer and prostate cancer. So cancer antigens for breast cancer would be like a CA 15-3, a CA 27.29, and also a CAA. I also like what's called a CA 125. These are all cancer antigens, and these can be elevated when you have cancer. So it's a blood test that we could actually do to track how the cancer is doing. We do not use these to make a diagnosis of cancer. It's like, okay, you don't have cancer antigens. That doesn't mean you don't have cancer, because I see these not show up all the time when patients do have cancer. What I do like about them, for me at least, is I'm able to track it. Okay, you are positive. Let's say you have a positive CA 15-3. I like that. That means, whoop, yay. We're actually able to track that and see if the therapies we're doing are actually working, instead of having to do toxic radiation or nuclear dyes to really track things. So we're able to just use a basic blood test that's non-toxic, very easy to do, and actually track how treatment is doing. So that's what I love about cancer antigens. Other conventional oncologists are using it that way too. So we're the same in that regard, but they don't. And what I'm noticing, a lot less doctors are ordering these for some reason, that I'm noticing in my experience recently with my cancer patients. Conventional oncologists are ordering less. Another one I like to order, and this is for prostate cancer, is we're going to be ordering a PSA. There's a lot of issues with PSA. It's not perfect, but that is something that I use to help track how the cancer is doing too, and if the treatments that we're prescribing are working appropriately. But that's a conventional cancer antigen that the oncologist order.
Okay, so we have some of these blood markers that are really helpful in tracking how the cancer is progressing. So I assume then if someone has a high marker, that's a higher chance that the cancer is active. But what's positive about having that marker is that if someone is actually that marker is showing up in their blood, a positive is that it can help. Okay, well, it is. So now we can actually look at that number and it can, if it drops down, we know your body's able to, is fighting this in a powerful way. That's a really cool way of kind of thinking about it. And I'm curious why some doctors are not doing it as much. I wonder if it's because, they're just preferring to go to CT scans and things like that. But, I think it's important that you mention, you don't want to just, get a whole bunch of CT scans anytime you want to check on your cancer, because every time you do, you are exposing your body to radiation. And so if there's another way that you can track in between, right, to kind of space those CT scans out, you have some markers that are actually showing up. Those are great ones to look at. So let's move forward. You had talked a bit about some of the standard ones, including fasting blood sugar, fasting insulin, and so forth, that are in some of these labs. What else do you like to look at?
Yeah, so now we're going to go talk about the fun stuff, the more innovative looking at how your body's doing to really improve the body or look at what's truly causing the cancer. So this is much more detailed laboratory work, and I love to do this for my patients to actually see what's really causing the cancer and be effective at treating the cancer how we want to, and really treat each patient as an individual. Someone might come into me with breast cancer, prostate cancer, but everyone is treated differently based on what their body is telling me and what the causes of their cancer is. So let's start with vitamin D. Very easy test. I'm sure all of you have heard it. Probably a lot of you have had this tested before, but it's very important with cancer. Vitamin D, we want that at a high range. So I like that level at least 70 to 90, maybe close to 100. So on the very upper range of normal, I like the vitamin D level to be. Vitamin D is needed for our immune system to work appropriately. So if your vitamin D is low, your immune system is going to be weak. So think of it this way. If we have really low vitamin D, it's shooting bow and arrows. If we have higher vitamin D, it's able to shoot machine guns, so to speak. So it makes it a much stronger immune response. So you might have low white blood cells, let's say a 2, which isn't good, but then we increase your vitamin D, those white blood cells are so much more powerful now. They have more ammunition, more better guns to be able to go after and kill the cancer cells. So very important, also very important for inflammatory state. So modulating the inflammatory state that's happening in our body, inflammation, the more inflammation you have in the body, the more the cancer is going to grow. It's kind of like sugar. The higher the sugar is, it's going to help the cancer grow, but higher in inflammatory state, it's going to be like throwing a wood on a fire, so to speak. Next thing I like to look at, and we're talking about inflammation, is highly sensitive C-reactive protein, also known as HSCRP. This helps me look at, okay, how much inflammation do they have? But also it helps me track is the patient at. If they have really high CRP, I'm like, the cancer is angry. It's going a little wild right now. We need to get on top of this really quick, because if we don't, the patient is going to die soon. So we can use this. It's not like a cancer marker. It's a health marker, how our body's doing, the inflammatory state. And that really goes off the charts when the cancer starts getting angry. And then we start seeing this going down. We're like, great, we're on the right track. We're treating the cancer appropriately, and the body's doing a lot better now. LDH is a similar type of thing. It's not with inflammation, but this tends to go really high when the cancer starts to get angry and it's starting to metastasize and go other places or growing quickly, is we see LDH. And this tells us about cellular metabolism. Tells us a little bit about how the mitochondria is working inside the cell, and that changes when cancer starts to get angry. And when we improve that, the cancer is usually starting to decrease in growth. It's not growing as fast or decreasing in size. So I really love this test. Very basic, easy test that we could do, and any lab does them, but it gives us a lot of good information with the patient with cancer. Next thing I like to look at is the sugar. So we talked about fasting blood sugar, very important, but also I like to see the insulin. This is probably even more important than sugar even. They're probably equal, but they go hand in hand. Insulin, so when you eat a lot of sugar, we produce a lot of insulin. And we don't want a lot of insulin circulating throughout the body, because that promotes cancer. So the higher the insulin, the more it's going to promote cancer growth. So I like to see where the insulin is at. Oh, do we need to do something metabolically? Do we need to modify your diet to decrease how much sugar you're getting into your body if your insulin is high? Because if we continue to have that high insulin, like I said, it's going to promote cancer growth. So that helps me know if we need to do any dietary changes in the body. Next thing is hemoglobin A1C. This is a blood sugar marker too. It just tells us where your blood sugar is at over a 4-month period of time. And the higher that level is, okay, we need to get this under control. We need to work on your blood sugar. We need to modify your diet, gives you some treatments to help with the blood sugar regulation. And my ideal number is, if we could get it, is 5.1. If we could get a 5.1, I'm really happy. If you're 5.4 or less, I'm still happy, but the ideal sweet spot would be a hemoglobin A1C of 5.1. Very important. I love to check this to see how the blood sugar is doing, and we need to modify the diet to help with decreasing the growth of the cancer. So if we could decrease that sugar, we're going to decrease the fuel that the cancer uses to grow. Next thing, this is seeing how the metabolism is going on in the body. We do a leptin adiptonectin ratio. And this tells us how metabolic changes. Is your metabolism working okay? Do you have a slow or fast metabolism? We want to keep your metabolism working great. One reason why people get cancer is the metabolism isn't working very well. Like the mitochondria isn't working well. When I say metabolism, that's relating to the little microscopic mitochondria in each individual cell that helps it function appropriately. So this gives us a good look at that, how your body's doing there. Here's some causes. We've talked about a few, but here's some big ones. I'm checking this a ton more in my patients now, is I check patients for mycotoxins or also mold. Mold is very immunotoxic, so it will suppress our immune system. Big reason why cancer forms in the first place is because the immune system becomes weakened, and then it's not able to gobble up the mutated cells that are happening every day. So me right now, everyone on the planet right now is forming cancer cells every day, but in majority of us, the immune cells are gobbling up the cancer cells. But if our immune system gets weak, it's not able to gobble up the cancer cells quick enough, and the cancer cells start to overwhelm the body and overwhelm the immune system. It's not able to keep up. And one reason how the immune system can't keep up is having mold. It's immunotoxin, damages it. Also, a piece of why cancer forms in the first place is the mitochondria stops working as well, and mycotoxins damage the mitochondria. So as you can see, just mold being in a house or in your food can really have a huge detriment on your health. Not everyone has a big issue. Some people detox mycotoxins really, really well. That's why not everyone in moldy environments is getting cancer or mitochondrial issues. But those people that don't detox very well are definitely going to have a big issue with mold. So I love to check to see if they do have high mold content in their body, and we need to address that. Next thing is chronic infections. I have top four. There's all kinds of other infections, but the top four that I look at is Epstein-Barr virus, cytomegalovirus, chronic strep, mycoplasma pneumoniae. So I look at those, see how those are affecting the immune system, our inflammatory state, and those can be a big cause of cancer. And if we see those, I like to treat those, get those taken care of, so we can eliminate some of the causes that are making the cancer grow. Last thing I wanted to talk about is called IGF-1. This has a little bit to do with insulin, but it's different. So this is insulin growth factor, and this helps you make growth hormone. Great, makes you more muscular and buff. But if we have really high levels of IGF-1, it's an issue with cancer. So we need to look at that and address that. And usually we need to work on metabolic changes in the body when we see that that's elevated.
Interesting. Now, when you were talking a bit about the microtoxins, and you were saying that some people have an easier time and some people have a more challenging time, especially if they don't know how to detoxify. Do you have any ways that you check with your patients on whether or not they do struggle with detoxification issues so that you can start addressing that?
Yeah, so it's really hard to really know if someone's having poor detox or not. There are some things that we could look at. If they have some liver trauma, we could look at that. If their kidneys aren't working as well. If they do have gut issues, like they have gas, bloating, diarrhea, constipation, especially constipation means they're not detoxing very well. But another big one, and this is one I left out too, in the big test I like to check for cancer, is homocysteine. And this tells me how the body is methylating folic acid and B12 well. So people that don't methylate very well, they don't detox very well. So that's something we could check there. And if I order for our gene mutation, and then see if we do need to supplement the patient with methylated folate. Yeah. So another thing I like to look at is homocysteine to identify how the person is detoxing from mold. I like to look at this in general with cancer because people that don't methylate well have increased risk of cancer. So we want to address that, but also they don't detox very well. So homocysteine is the first indicator. High homocysteines tell me, okay, they don't methylate folate very well. Now let's order MTH for our gene mutation to see if they do need to take methylated folate or not. So that can be an indicator when I do see that the homocysteine is elevated. Okay, maybe they have increased risk of possible mycotoxin damage.
Excellent. Well, Dr. Jake, this has been so helpful. So this is a really comprehensive list, Dr. Jake, that you have, what's an easy way that we can make sure that our listeners and viewers have this list so that they can either give it to their doctor and say, hey, can you get these labs done for me, or find a doctor who can?
Yeah, so we're going to have a link and a form that you can fill out to be able to get these labs. So we're going to have it all printed out for you, and you could get these labs and you just print it out. And you could take it to your doctor and be like, these are some labs I really would like to be done. And probably a lot of times your doctor will be able to draw these for you. The only possible issue is they don't know how to interpret appropriately. And that's when you go to an integrative doctor like me to really give you a good interpretation of these labs.
So we'll make sure and have this link in the description box if you're watching this on YouTube, and in the show notes if you're listening to this on the podcast. And if you do have any trouble getting some of these labs because either A, they just don't, or B, because they don't know how to interpret it or what they mean, we'll also have a link in that sheet as well as in the description box below where you can schedule a call with Dr. Jake, and he can order these labs for you. He can even see you virtually, and you can get these labs done at a lab, near you, and then he would still get the reports to be able to share with you what they mean and what kind of treatments, he can do with you in order to be able to address some of the issues that come up in those labs. So really excited to be able to offer that to you guys, and we'll make sure and have those in the show notes. Thank you so much for your expertise today, Dr. Jake. Is there another video that some of our viewers can watch to be able to help them with next steps?
Yeah, now that you understand what labs that you need to do alongside your conventional labs, the next step would be is what supplements you need to take to improve your outcomes alongside these labs. Click my videos to the left. I'm Dr. Jake, and I'll see you there.